Welcome to EM Supply Room Series, Ankle Stirrup.
Step 1. Gather your supplies. Soft roll to protect the skin. Plaster for shaping the splint. Scissors for cutting plaster. Ace wrap. Tape for securing the ace wrap. And a basin of water. Step 2. Position and prep your patient. Position foot at a 90-degree angle. Apply soft roll to cover all skin surfaces from the base of the toes to the mid-calf area. Step 3. Measure out plaster. Measure from mid-calf to mid-calf going underneath the heel. Step 4. Cut 10 to 15 layers of plaster. Measure 10 to 15 layers of plaster, or more if needed. Step 5. Wet and apply plaster. Submerge plaster into warm water, squeezing out any excess water. Apply plaster to patient's leg, ensuring no plaster touches the patient's skin. The plaster should be under the patient's heel, not on the arch of the foot. Using soft roll, secure the plaster in place. Continue to mold and shape plaster as it continues to dry. Finally, apply the ace wrap. Check color, cap refill, temperature, sensation, and movement of the toes.
Now go practice!